Hi, Matt Gibson, John Forrest, coming to you live from ACC 23 here at Access Points. We're talking about the Evolut low-risk study. Talk to us a little bit about TAVR in these low-risk patients.
Well, I think it's different than we have in high-risk patients, where really they're high-risk patients, they're older. We want them to do well for a couple of years, and that's what we're looking for. In low-risk patients, we need more than just a couple of years. This is a lifetime.
Got to make sure it's durable.
60, 70, 74-year-old patient, you want to make sure it's not just going to work well for 1 or 2 years, but 5, 10, and they're out. And with what we have from the TVT registry, we just have 1-year data. We don't follow them longer. That's why these studies are so important. You combine that with the importance of shared decision making. How are we supposed to do shared decision making if we don't have the data?
You have to have data for decision making. So, looked at 2 years, but now you're talking about the 3-year data. What did you find?
So we found at 3-year data that the curves continue to have a separation. Okay, doesn't quite meet statistical significance, 0.051, but I think when you look at it, it's a 30% reduction in mortality or stroke and
disabling stroke.
Disabling stroke, mortality. Thank you. Mortality or disabling stroke, and there's not a convergence of the curves. The valve's working well, and when we look at sort of why is the valve working well, we know this valve was designed to have excellent hemodynamics, and we've started to learn things about leaflet thrombus, which may be an issue with some other valves. We compare leaflet thrombus with this valve to surgical valves. They're the same. Not that it's not an issue, but it's similar between the two.
And hemodynamics were better.
Hemodynamics were a little bit better.
And AFib was lower, correct?
AFib was lower.
And there's a lot of AFib people on the surgical side.
It's a lot of AFib on the surgical side. Pacemakers are higher. Yeah. Right. So it's not all
so it's a little
positive.
Bit of pacemaker versus AFib. I'd rather have a pacemaker than AFib, but that's just me. So what's the take-home message?
I think the take-home message is that patients, physicians, heart teams can continue to be comfortable offering this as a therapy for patients. Still a lot of decisions that need to go into what you're going to do for a young, a patient who's, under the age of 75, between, 65 to 75, what you're going to do for that lot. But you're confident now saying, look, you know what? The data we have looks good. We'll keep following the patients for 10 years so we get it. But patients and providers can be confident.
Durable outcomes to 3 years. Thanks, John. Thanks for joining us. Thanks to all of you for joining us here live from ACC 23.